Hi, my name is Alex and I'll be presenting my topic on radiation oncology that is very commonly performed in order to cure a wide range of different cancers. For the Épreuve Synthèse, the presentation will incorporate physics and biology to explain the basics of radiation therapy. To give a brief history of radiation, I'll cover some of the most important discoveries that led to radiation being such a common form of oncology today. First, in 1895, a professor named Wilhelm Conrad Röntgen discovered X-rays, for which he won a Nobel Prize in 1901. This was the first ever physics Nobel Prize won. He discovered this while working with a cathode ray tube in his lab. He observed the fluorescent glow of crystals displayed on a table near the tube. After further experimentation, he concluded that a new type of ray was being emitted from the tube that was capable of passing through most substances, casting shadows of solid objects. Later, in 1905, Albert Einstein discovered the photoelectric effect, which won him a Nobel Prize in 1921, and this experiment was surprising to many physicists as it went completely against the wave model of light. It was very counterintuitive based on all prior wave discoveries, and Einstein's solution was that light is quantized and travels in tiny packets he called photons, and that'll be talked about later. In 1952, the first linear accelerator was used for treatment, and this is the most common source of radiation used today. In 1970, computerized tomography, better known as CT scanning, was invented where it was later used for more efficient methods of radiotherapy, such as conformal radiation therapy, abbreviated CRT. This form uses CT imaging and special computers to precisely map the location of a cancer in 3 dimensions. The radiation beams are matched to the shape of the tumor and are delivered from several directions. And in the not-too-distant future, in 1988, intensity-modulated radiation therapy was performed, which is the same as CRT, but the intensity of the beams are adjustable. This allows for control in decreasing the radiation to normal tissue while delivering a high dose to cancer cells. Now, I'll go over the types of medical oncology that are most often used and performed on a regular basis, and there are 3 common types that I'd like to outline here. To start, surgery is the most obvious option, where the surgeon will cut out the tumor and essentially what they can see. Whereas in chemotherapy, they basically bathe the body in a mixed drug solution designed to kill fast-growing cells, and this is usually done via IV fusion through veins. Radiation is the one we will discuss in greater detail throughout the presentation, and radiotherapy is often done to complement other methods due to the fact that it eliminates the microscopic extensions of the tumor, where surgery would possibly not be good enough to eliminate all of the cancer and prevent recurrence. Curative and palliative care are 2 methods of treatment with different goals in mind. The focus of curative treatment is to eradicate the cancer, which is linked with goals of prolonging life, increasing survival outcome, and prevent recurrence. It can be used as the only mean of treatment. For example, a patient with low-risk prostate cancer can be treated with external beam radiation therapy alone. As discussed earlier, radiation treatment can be complemented with other forms such as surgery. In curative care, the strategy may be a multi-step process in order for the best possible outcome of the patient. For example, early-stage breast cancer can be treated with surgery and then radiation afterwards. This shows how the different types of treatment can be used together in order to provide each of their advantages at the same time. Palliative care is more focused on symptom control rather than eradicating the cancer, and it would be done if the patient wouldn't benefit from further curative treatment or decides against it. Patients with high-risk cancer or multiple other conditions can be treated with palliative care as their life expectancy may be poor. So that's kind of the difference between 2 methods of care that are used often and have separate expectations for the patient. So, what is radiation? Radiation is the emission of energy in the form of waves or particles that travel through space or a medium, like a vacuum or air. Einstein gave these packets of particles of light the name photons, which is very commonly used in radiotherapy. The electromagnetic spectrum shows the wavelengths of radiation that have been discovered. Visible light is in the middle of this spectrum, in between ultraviolet and infrared, and does not have enough energy to damage cells, as it's only light. X-rays and gamma rays, however, have a shorter wavelength and a much higher energy, and these are commonly used in radiation therapy. Also, all radiation must come from a source. For example, visible light comes from the sun. Radio waves may come from your smartphone, and X-rays for cancer treatment come from a man-made machine called a linear accelerator, which will be discussed in the next slide. Now, I'll talk about the equipment commonly used for radiotherapy, which can be thought of as the source of radiation. As I said earlier, all radiation comes from a source. The source for cancer-killing radiation is a linear accelerator, which basically accelerates charged particles, often electrons, to high energy, which collide with a metal target, releasing photons directed towards a patient. The photons are usually X-rays or gamma rays, as these particularly have enough energy to ionize atoms. Alternative uses are protons and electrons, but are less commonly used. An advantage of protons is that they tend to deposit energy with more precision, with the advantage to spare more normal tissue. Electrons deposit energy closer to the skin and are better for treating more superficial cancers. Ionizing radiation is the concept in which the high-energy radiation on the electromagnetic spectrum discussed earlier, which were X-rays and gamma rays, have enough energy to ionize atoms in their path. This is when an atom loses a particle, most often an electron, and becomes positively charged, which can disrupt biological molecules and potentially kill cells. This is the beginning on how radiation can kill cancer cells. There are two mechanisms for which radiation can cause damage. It can cause direct or indirect DNA damage. Direct DNA damage is less frequent, and it's basically when a photon hits an electron, which then directly damages DNA. Indirect DNA damage is much more frequent, and it occurs when a photon hits an electron, which then ionizes water, and creates a superoxide radical, which is highly reactive and toxic. The radical will then go and damage the DNA strand. The goal of radiotherapy is to produce a double-strand break in the DNA, which is when both strands of polynucleotides are broken in the same spot. This produces lethal damage to the cells where they can undergo mitotic catastrophe or apoptosis, which are two types of cell death. It will be harder for the cancer cells to overcome this damage due to their lack of organization and frequency of division. The cell is most vulnerable to radiation when it's in its M phase of the cell cycle, where the chromosome commits to dividing and will be most easily damaged. Cancer cells divide more often than normal cells, which means they'll be caught in this M phase more often, making them more vulnerable to radiation as well. Fractionation is the method used to break up the radiation treatment into smaller doses given over time in order to allow normal cells to repair while cancer cells less so. It is done in order to distribute damage more effectively. The main goal is to catch cancer cells in their M phase more often, as if it is given in one giant dose, not all cancer cells will be in their M phase all at the same time. Radiotherapy hinges on the fact that normal cells will heal better than cancer cells, and fractionation allows the normal cells to recover. The fundamental mechanisms of radiation therapy can be summarized into the 4 R's, namely repair, repopulation, reassortment, and reoxygenation. For repair, the fact is that normal cells repair better than cancer cells, and fractionation allows for the repair of these in-between treatment fractions. For repopulation, tumor cells can repopulate when they are incompletely damaged. Therefore, each fraction must cause more damage than the cell's ability to repopulate. Fractionation also allows normal cells to repopulate. On to reassortment. Each fraction allows cancer cells to be caught in their M phase multiple times to deliver considerable DNA damage. So I think of it as lining up the cancer cells to be killed at the perfect time in each fraction. And finally, reoxygenation. Tumor cells further away from the blood supply, such as in the center of the tumor, are hypoxic, which means they are oxygen deficient. Most radiation damage was said to be indirect DNA damage through radicals, and oxygen is important in producing these toxic superoxide radicals. Fractionation allows for oxygen-rich tumor cells to die off first, and the hypoxic cells from the center will be reoxygenated. These cells will be more vulnerable to radiation in the next fraction, and the cycle will continue until hopefully the tumor is eradicated. To conclude this presentation, I would like to briefly talk about the common fears in cancer survivors and the limitations of science with regard to cancer. A very common fear in cancer survivors particularly is recurring cancer, as it is very possible for cancer to come back after it has said to have been cured. This is due to the fact that tumors can be visibly gone, but it's possible for some microscopic extensions to go undetected. It is sometimes hard to eliminate 100% of the cancer cells, depending on the severity of the cancer. If cancer were to come back, it would be most likely within the first 5 years after treatment, as it is unlikely for the cancer to recur past that. It's shocking that we still don't have a complete cure for cancer after all the funds and research that have been put into it, but I'm confident that one day we will have a cure for even the most severe cancers. Nonetheless, treatments used today, including radiation therapy, are quite excellent forms of treating cancer for the time being.